Good afternoon, everyone.
I am in the company this morning of my colleagues, Madame Diane Leboutillier, qui est la ministre du Revenu,
who is the Minister of National Revenue,
who is Minister of Employment, Workforce Development and Disability Inclusion. Also with us is Dr. Teresa Tam, who is Canada's Chief Public Health Officer, et le Dr. Howard New, qui est l'administrateur en chef,
who is from Health Canada.
Ministre Trudeau.
This morning, Prime Minister Trudeau made some important remarks. He reminded us that vaccinations are underway, and he talked about Moderna and Pfizer, that vaccines that are being delivered to the territories and the province, and that starting next week, we expect the number of Pfizer doses will be increasing. He also quickly informed us that starting Monday, February 15th, any traveler crossing the American border coming into Canada for non-essential reasons will have to show a negative PCR test before they can gain entrance into the country. He also pointed out the importance of using rapid testing that the provinces and territories received, and that the private sector is in the process of taking measures to improve the safety of Canadians.
Minister Qualtrough for opening remarks.
Bonjour tout le monde. Hello, everyone. Je suis très heureuse de me joindre à vous aujourd'hui avec mes collègues.
I'm very happy to join you with my colleagues, Minister Leclos and Minister Leboutillier, for this important announcement. Since the first day of the pandemic, we have implemented historic income support measures to help Canadians get through this crisis.
Families pay for things like food and rent at a time when we were asking people to stay home and flatten the curve. For many Canadians, this meant difficult weeks and months where very little, if any, income was coming in. We made the CERB's eligibility criteria as broad and inclusive as possible so that workers who needed support could get it, as income takes different forms. As announced by the Prime Minister this morning, if you applied for the CERB based on your gross income of $5,000 instead of net pre-tax income, and you met all the other eligibility criteria, you will not have to return your CERB payments. This means that as long as someone's gross self-employment income was at least $5,000, they won't have to repay the CERB.
To reiterate in French, if someone applied for the CERB based on gross income of $5,000 instead of pre-tax net income, they will not have to reimburse their payments. Of course, we'll have to meet all of the other eligibility criteria.
In these steps, we are giving certainty to self-employed individuals who applied in good faith for the CERB. As I've said before, we'll always have the backs of Canadians. Today, we're also announcing targeted interest relief for Canadians who are facing income tax debt for the 2020 tax year as a result of having received COVID-related benefits. This will give Canadians who file their 2020 income tax and benefit return more time and flexibility to repay amounts owing. It also means interest won't have to be paid on any outstanding income tax debt for the 2020 tax year until April 30th of 2022. To qualify for this relief, individuals must have had a total taxable income of $75,000 or less in 2020 and have received income support through any of the COVID-19 targeted income supports. Nous avons fait de grands efforts.
We have gone to great lengths to help workers get through this pandemic, and we will be there to help Canadians. I would now like to turn the floor over to Minister Boutillier. Good afternoon to everyone. I'd like to say hello to Minister Qualtrough, who is on the west coast of Canada. So the Gaspé and the Magdalen Islands say hello to you. And I'd also like to say hello to Minister Duclos. Our government is sensitive to the fact that Canadians are still feeling the financial impact of the pandemic, and I can assure you that we're here to help you get through these difficult times. To do this, our government has implemented an interest relief measure for certain Canadians who will have a tax debt for the 2020 tax year. After filing their income tax, the eligible people will not have to pay interest on unpaid debt for the 2020 tax year until April 30th, 2022. To be eligible for this targeted measure, a person who has earned taxable income of $75,000 or less in 2020 and have received at least one of the emergency benefits offered, that includes the CERB, the student emergency benefit, the Canada Recovery benefit, the Canada Recovery sickness benefits, the Canada Recovery caregiver benefit, or any employment insurance benefits or measures offered by provincials. It is intended that this measure will provide some interest relief to approximately 4.5 million Canadians who have been affected by the pandemic. In addition, the parameters of the payment agreements have been amended in order to give more time and flexibility to Canadians to pay their debt based on their ability to pay. In addition, I'd like to note that the agency will automatically apply the interest relief measure for those individuals who meet the criteria. With this measure, Canadians can continue to respect their tax obligations without suffering from additional financial consequences. As Minister of National Revenue, I'm proud to see that the agency puts people first. Our government is determined to help Canadians deal with this pandemic. Thank you very much.
Merci, Madame Le Boutillier.
Thank you, Ms. Boutillier. Dr. Tam, please give your remarks.
Bonjour à toutes.
Good afternoon, everyone.
8,120 cases of COVID-19 in Canada, including 20,835 deaths and 40,175 active cases across the country. Over the past week, there were, on average, over 103,000 tests completed daily across Canada, of which 3.7% were positive for COVID-19. And national daily case counts have been declining for several weeks. Over the past week, there were an average of just over 3,500 new cases reported daily, which is less than half the early January peak of over 8,100 daily cases. This is gratifying progress, knowing the sacrifices we have all been making. And we are now seeing the additional benefits in the steady decline of severe illness outcomes that is relieving some of the pressure on the health system and workforce. Over the past 7 days, the average daily number of people with COVID-19 being treated in Canadian hospitals has declined by 15% to just under 3,300, including 728 in critical care, and fatal cases have dropped by 20% to 100 deaths being reported each day. While declining case counts, hospitalizations, and deaths are reassuring, we must continue to be cautious. Over the past week, the total number of new virus variants detections has more than doubled. 7 provinces are now reporting variants detections. And the first detection of the P1 variant that was first found in Brazil has been reported by Ontario. Although it is normal for variants to emerge as viruses continuously evolve, these are considered variants of concern because they're known to spread more easily. There is also a possibility of reduced. This is why we need to maintain the strictest vigilance in our public health measures and individual practices. This will help to prevent these variants from re-accelerating the epidemic and making it much more difficult to control. With now more than 355 B117 variants, 25 B1351 variants, and 1 P1 variant reported in Canada, together with evidence of community spread in at least 3 provinces, and links to outbreak activity in long-term care homes and other congregate settings, including a workplace, the risk is very real. But for every dark cloud, there is a silver lining, and we have several advantage points to work from. First and foremost, we know what works to control this virus, whether new variant or old. And second, we have the benefit of foresight from other countries who have demonstrated the effectiveness of sustained and vigilant public health measures to control new variant spread. Our way forward is clear. Right now, our measures are working. This means doing everything that we've been doing, but giving it the best we can give at all times. This simple rule can help us limit the spread of more transmissible variants while vaccine programs get underway. Aim for the fewest interactions with the fewest number of people for the shortest time at the greatest distance possible. Stopping the spread of COVID-19 is up to all of us. Thank you.
Bonjour à toutes et à tous.
Good afternoon, everyone. There have been many cases of COVID, 20,037 deaths, and 40,000 active cases throughout the country. Over the past week, over 130,000 tests were carried out daily in Canada. 3.7 proved to be positive to COVID-19. The daily rate of new cases on a national scale has been decreasing for several weeks now. During the last week, 3,500 new cases on average were reported daily, which represents less than the half of the number of daily cases reported back in early January. So we are dealing with remarkable progress. We know about all the sacrifices that we've all made. Now we see that there are still some serious cases out there, but there is, in fact, less pressure being put on our healthcare system and its staff. Fewer than 3,000 people with COVID were treated daily in Canadian hospitals. So 7,028 were in intensive care, which represents a 15% decrease. And this is being reported, and on a daily rate, 25% fewer cases. The cases of hospitalizations and deaths is reassuring, but we must continue to pay attention. Over the past week, the total number of cases reported of new variants of the virus has more than doubled. 7 provinces have said that the variant is present, and Ontario said that it detected for the first time variant P1, which was detected in Brazil initially. Viruses continue to evolve, and it's understandable that variants do crop up here, but these variants are more transmissible. It is also possible that the current vaccine may provide less protection. That's why we have to be vigilant, and we must apply our public health measures, and this will prevent these new variants from causing another upsurge in the pandemic, one which will be more difficult to control. Given the number of cases that have been reported and the new variants in Canada, that is 3,500 for the variants B17, 25 for B17, and 1 for P1. Shows that there has been propagation in the community in at least 3 provinces, and there are links with outbreaks that are occurring in long-term care residences and in congregate settings, and including the workforce. So the risk is very real. But we have to look at the good side of things because we can take advantage of some very positive points. First and foremost, we know how to deal with this virus, whether we're talking about the old virus or the new variants. We also have the advantage of the experience gleaned by other countries that have shown the effectiveness of being vigilant on a daily basis in order to control the propagation of these new variants. The process is clear. Right now, our measures are working. We have to continue all that we're doing and to take action on a regular basis. These simple rules will help us prevent the spread of this more contagious virus as we continue with our vaccination programs. We have to have as little interaction as possible with as few people as possible at a wide distance from each other. It's up to us all to deal with this virus.
Thank you, Dr. Liu. We would now be pleased to answer any question.
Merci, thank you. We will now move to questions on the phone for one question, one follow-up each. Nous allons procéder aux questions au téléphone pour une question de suivi chacun. Opérateur, première question. Operator, first question.
Thank you. Merci. The first question is from, la première question est de Bill Curry de Globe and Mail. Please go ahead. À vous la parole.
Thanks for Minister Qualtrough regarding this CERB gross versus net announcement. I guess three very precise questions. Roughly how many people are affected by this situation? What's the fiscal cost of making this decision? And then lastly, what do you say to those people who didn't apply for CERB because they went with the net income definition and now they realize that they'd gone with the gross, they could have received thousands of dollars last year?
Well, thank you for those questions. Very specifically, this response today addresses a specific issue of unclear information that was provided by our government that Canadians then relied on, in particular self-employed Canadians. We will have a better clarity on the number of people who are impacted by this when people file their taxes. We have a sense of a possible range, but it's really difficult right now because so many people haven't filed their 2019 or 2020 taxes, and their eligibility and their gross income will be calculated based on that information. So it's a bit premature for me to say how many people, but we know that as a bigger number, we sent out 440,000 letters to people whose eligibility still needs to be confirmed. A subset of that amount are in this particular circumstance. In terms of the cost, again, it will depend on the number. And what I would say to people who didn't apply for the CERB is, I appreciate the frustration you may feel with this, but we are dealing here with a subset of the 9 million Canadians who applied for CERB who legitimately and honestly relied on misinformation we provided. And that's the problem we're solving here today.
As a follow-up?
No, I appreciate the three answers. That's great. Thanks.
Okay, thank you. Opérateur, prochaine question. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Hélène Buzetti de Le Devoir. Please.
Question, Le Devoir. I'd like to piggyback on the question posed by my colleague, this question of fairness. I do understand that there was information that wasn't clear, but a lot of people thought that they had understood the rules correctly, and so they didn't apply. So why not enable those people to retroactively make an application? Thank you for your question. I would say that we came up with a solution that is fair and reasonable under the circumstances for those people who have been affected by the lack of clarity in the information that we provided to Canadians. In all honesty, we can't reopen the legislation. We decided to not apply this decision retroactively to all Canadians. Today's solution deals with that group of Canadians that really misconstrued the information that we provided. As a follow-up, I don't know if the minister can answer this question, but with respect to these border measures, these land border measures that were announced, so you may have a penalty. There was talk about follow-up. Can someone be a little bit more specific about what would be expected for these Canadians returning to Canada and getting their test results? Yes and no. I don't have all of the information that you are requesting, Ms. Buzetti. We are expecting that the vast majority of people who come to the border, land border, with a PCR test that they will do so because we have announced 6 days ahead of time what the expectations were. These people who come to the land border without a test, as the Prime Minister did this morning, there will be a fine that they'll have to pay. The border security officers will be dealing with this, and the individuals will have to provide more precise information. As for follow-up, that is part of the police mandate. Your Minister Blair will be able to provide you with that type of information.
Thank you. Merci. The next question is from La prochaine question est de Mia Robson, de Canadian Press. Please go ahead. À vous la parole.
Hi, Dr. Tam, I'm wondering if you could talk a little bit more about the variants. You said that we know what to do to stop them. So that sounds to me like the existing measures we have in place should be enough to keep those variants from spreading. And we've seen some positive progress in the last few weeks, but we're also looking at provinces that are now lifting those restrictions that have maybe helped that progress along. Wondering if you're concerned about if lifting any of those restrictions, the lockdown measures, loosening those rules are going to have an impact on whether or not we continue this progress because of the variants or maybe even in spite of them.
Thank you for the question. And I think absolutely we've made good progress as we just went through in my remarks. But any loosening of these measures has to be done extremely cautiously because, as we all know, the population immunity level is not high. We're just beginning our vaccine programs. We've done many weeks of work in bringing down this epidemic curve, and the hospitalizations and deaths are beginning to come down. This is not the moment to really to sort of release everything that we've in terms of public health measures. I think province territories, of course, are making their individual decisions based on their own context, but all must do it with extreme cautiousness. And I believe some of them have plans to reapply public health measures very quickly, and if they see any changes. I think what my concern is that right now, if we release some of these measures, that a recur, but that resurgence could be due to one of these variants, and then it will be much more difficult to control. So first of all, increase our testing and identification and sequencing and screening for these mutations is being escalated, but we need to do even better, I think, than what we're doing now. Provinces are screening more. Some provinces are aiming to screen every positive test for the variants, and that would be a good goal to aim for, increasing testing in the community. So it's, again, a balance of you can only ease things when you got the proper measures in place to rapidly detect and be able to implement public health measures again if needed. But I think, it is a concern. So when we said, right now, the simplest rule of thumb is still, restrict non-essential activities as much as possible. So aiming for that fewest interaction with the fewest number of people for the shortest time at the greatest distance possible is a very simplified way of looking at how we want to manage until the vaccine programs are well underway and that we learn more about these variants. But have you seen in Europe, if you looked at England, Ireland, France, other countries, public health measures do work. So I think that is our sort of primary message. But yeah, do so with caution. If anything is going to be relaxed, then the proper measure for monitoring and response has to be in place.
Thank you for that. My follow-up question, I think maybe is for Minister Qualtrough. there are more people in that who got those letters, the 440,000 letters, than are being referred to today in sort of getting a reprieve from having to pay it back. Are you considering further amnesty for any of those people? And if so, what?
Well, thank you for the question. Just to be clear, the letters were sent out proactively by CRA to people for whom they couldn't confirm eligibility. Many of these 440,000 people have now filed their taxes, have been deemed eligible, aren't in that list anymore. So it's not, let's not assume that all 440,000 will be ineligible, because we just can't. We just didn't have enough information. CRA didn't have enough information at the time to determine eligibility. And many Canadians have since filed their 2019 taxes, their 2020 taxes, and we've determined that they were eligible. If there's a specific subset of that you wish me to respond to, I can. But ineligible or eligible, we're going to work with Canadians to make this as seamless as possible for them. There's no requirement for people to repay now if they're deemed ineligible. We've announced today no interest on any tax you may have incurred as a result of being eligible for CERB. We're really trying hard to work with Canadians, relieve them of any stress or anxiety associated with our having helped them through the pandemic.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Christian Noël de Radio-Canada.
Question, Radio-Canada. Good afternoon. Thank you for taking my call. I have a question on the tests of people who are coming back to the country and need to have a negative test showing they don't have COVID. If these people have already had COVID and if they have a test that shows that they're still positive, will they be exempted from the quarantine, or will they be treated differently? They're not necessarily contagious, even though if they at one point had COVID. Yes, that's an excellent question. And I'd like to invite my colleague, Dr. New, and Dr. Tam to answer. This is a process that we have been seeing in the airport. Thank you very much. I'll begin. Dr. Tam can add to that. Now the requirements for all travelers coming to Canada, they need to have a negative rapid test before they can arrive. But as you said, and as you pointed out, there are some individuals who have already had COVID-19. And so with the science and probative data that's still changing, we can see that those individuals who are now in good health and have already had COVID-19, after 10 days after the appearance of their symptoms, they're being viewed as being recovered and no longer contagious. So we're going to come up with a way to have some type of other certificate for those who have already had COVID-19 in the past, but this would be paramount to having a molecular test before arriving. Dr. Tam, did you want to add to anything? We're going to consider those individuals who have recovered from COVID-19 as well. We could enable those people who show that they've had a test for COVID after the 10 days after the disappearance of symptoms, and within 90 days following the disease.
Count of people who've had COVID-19 who can demonstrate that they have passed the period of communicability, 10 days after they've got better. But because we do not know the duration of immunity at the moment. I think what we're thinking right now is 90 days since you've had the illness. You can still count that period, and that will be a test, that pre-departure test.
Oui, c'est pas ajouté en français pour.
Just to add to that, we do see that individuals who 10 days after disappearance of symptoms are viewed as being recovered and are no longer contagious. But there's this 90-day time period as well, because people may have had COVID-19, the 90 days have gone back, but they might be reinfected with COVID-19. So we have to consider all of those factors we're looking at science, which is changing, evolving constantly. Thank you very much. Follow-up question. Amnesty for those who have made a mistake with regard to their net and gross income. My question is as follows. If we do have this amnesty for people who made a mistake in good faith, Ms. Qualtrough, you said you had an idea of the cost that this may represent without being too precise. There must be a maximum minimum cost. How much does the government evaluate that this will be in terms of unpaid revenue? Thank you for your question. As I said, we don't have an exact figure with respect to the number of people who benefited from this decision, who will benefit from this decision today. It really depends on their tax filing. I'm sorry, I don't know how to say that quite in French. So it's difficult to determine how many people this applies to. So it'd be premature to put a precise figure on this. It really it depends on other factors as well, such as the eligibility, not only for the net and gross income, but for other factors. If you're not eligible for other reasons, if you shouldn't have got benefits, well, that's something that has to be considered. So I'm not comfortable to give you an exact figure without having exact information first. Thank you.
Next question, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Karina Roman from CBC News. Please go ahead. À vous la parole.
Hi, yes, thank you. My first question is for Minister Qualtrough. You were quite clear repeatedly that the government was not considering giving this kind of amnesty to the CERB recipients who did it in error, saying there was no conversation happening about that. Can you give us a sense about why this about face? What's the impetus for the reversal of that?
Well, thank you. You're absolutely correct. In December, I said we'd made no policy decision to permit people who had applied based on their gross income at the time. We've dug in. We've heard from many Canadians who find themselves in difficult positions because of this honest understanding of their eligibility. We've took the time to come up with a solution that balances all of the complexities that you've been asking about today in terms of fairness and reasonableness. And we reached a conclusion that the fairest and most reasonable way to move forward on this would be to allow people who applied using gross to not have to repay their benefits.
Okay, thank you. My other question is for probably Dr. Tam. As cases of the COVID-19 variants, as they become more numerous in Canada, as they're rising in Canada, should we be testing all positive cases for those variants? And since we're not doing that currently, are we right now underestimating the prevalence of these more contagious mutations of the virus?
Yeah, so Canada is, compared to other countries, is testing a higher proportion of our lab positives right now for the variants. However, we can sort of accelerate that. There are two aspects to how we increase our capacity to detect the variants. One is what we call a screening test for the actual mutations, like the N501Y of interest. That does not require whole genome sequencing because that takes a while. So that kind of screening for mutations that are of interest is being undertaken in provinces right now. And as the numbers of cases come down in a number of provinces, they are aiming to screen all of their laboratory specimens for those mutations. So that capacity development is underway. And the whole genome sequencing, which can be done on a subset of these, that capacity is also being sort of accelerated. For example, the Public Health Agency's National Microbiology Lab, in conjunction with the CanCogen genomics sequencing initiative in partnership with Genome Canada. So then you can also look at the whole genome on a subset of these. So I think we are accelerating right now, which is why I've been sort of saying that people need to be very cautious. These testing capacities are just accelerating. As you said, we might not know the full extent of the where these variants are in Canada at the moment. Provinces have done a huge amount of work when they find a variant case to be very diligent in contact tracing and looking at searching for cases and sequencing any cases around those. So that's another way of looking to see if these variants have spread. So I don't know if that answers your question, but it's true that we may not be detecting all of them for sure. And I think we may assume, for example, for the B117 variant, that there is a certain degree of community spread. The other variants, we're detecting less of them, but some of them, for example, some of the South African variant cases or the B1351 variant cases were not linked to travel. So that tells us that there's a degree of community spread, but that doesn't seem to be wide at the moment, but it's something that we need to be very cautious about.
It's Dr. New. Maybe I can just add a couple points to what Dr. Tam said. I think we have to look at the opportunity cost and be sort of effective and efficient. It's not strictly what I would call a laboratory exercise, testing every single sample. We can always do that, but then you might, sort of be looking for, maybe sort of not in the most economical and effective, efficient manner. So as Dr. Tam mentioned, it's, doing it maybe on a sampling basis in terms of samples that come into the laboratories in the provinces, territories. It's also focusing with the public health and the epidemiological side. If there are certain events, cases like a super spreader event, then certainly that would, I think, point provincial officials to do maybe a more targeted testing of the samples involved with that maybe outbreak. For certain, especially if there are cases associated with incoming travelers to Canada, that would be another priority to look at in terms of doing the sequencing, looking for the variants. And then, of course, we're now looking in terms of potential impacts in terms of vaccines. So any of the cases that might be associated with individuals having received a vaccine dose, I think would be something else we'd be looking at in terms of seeing if there are variants around, if there's any impact in terms of the vaccine effectiveness. Thanks.
Thank you. Merci. We will take two final questions. Nous allons prendre deux derniers orateurs. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Abigail Bimam de Global News. Please go ahead. À vous la parole.
Thanks for taking my question. I'm looking at the issue of so-called vaccine chasers, people looking for leftover vaccines at the end of the day. I'm wondering if nationally we're tracking what percentage of vaccines is usually left over at the end of the day, and if there are guidelines specifically for who those vaccines left over daily should go to.
So it's Teresa Tam. I could take a first try at answering your question. So I think with the actual implementation of vaccine programs is up to the provincial and local authorities. And of course, I think that if there are any leftovers, nobody wants to waste them. So any way in which people can get them into people's arms is really critical. And I think it depends on the setup and the situation where that clinic is. So I think that has to be, looked at. I don't think we do not track every single bit of leftover vaccine or where they go to. That would be up to the local authorities. What we do try and share is best practices and making sure that provinces can share how they reduce any kind of wastage. And as far as I have been informed, provinces have done very well in terms of not wasting, any of the doses. So, yeah, and I think of course, as best as possible, go to the groups already identified as priority groups at higher risk of illness, serious illness, or at risk of transmitting those with highest risk of illness as well.
Yeah, it's Dr. New. I just add that there was, as you know, a technical media briefing, and Health Canada has now officially approved in terms of the product monograph that at least for the Pfizer vaccine, they're now officially 6 doses in a vial as opposed to 5 doses. So I think the real live issue right now is to ensure with our provinces and territories, our partners, that you can reliably and consistently get the 6 doses out of the vial, and the information that the Pfizer has submitted to Health Canada is confident that with good technique and also with the right kind of syringes, that what we call the low dead volume syringes, that you can reliably and consistently get the 6 doses out of a vial. And so we're supporting the provinces and territories with webinars to make sure that we reinforce what the good techniques are in terms of vaccinators drawing the doses out of the vial. And of course, one of the terms and conditions also put on the Pfizer company is to work in terms of continuing education, working with our procurement folks to make sure also that that they're supported, and that also that we can get the low dead volume syringes, make sure that the vaccinators in the provinces and territories have them to use for their vaccination with the Pfizer vaccine. Thank you.
Dr. Tim, I heard you talk about how your role involves providing best practices or sharing best practices with the provinces. I'm wondering if, as the vaccine rollout increases, or as the number of doses increases, are there best practices being suggested to the provinces for any leftover doses at the end of the day, and where, non-priority staff in some of these settings would fall in that case?
Yeah, so as everyone probably knows, there is a National Operations Center for the implementation of vaccine programs under Major General Danny Fortin. We also have public health networks, which includes the Canadian Immunization Committee, that is the federal, provincial, territorial construct, and they are sharing these kind of informations all the time. And so they are constantly sharing best practices. And as we move from, right now we don't have that many doses of vaccine to be administered. The best practices are also moving on to a point where we have many more doses available, and then how are those clinics carried out, and how to minimize any kind of wastage is also being discussed as well. So those are the kind of governance tables that help share best practices. We also communicate with healthcare professionals organizations, and as Dr. New said, some of these training programs to make sure that they're not, minimizing any sort of wastage. But there are other strategies too. I think that we learn from other countries where the simpler the set of instructions are in rolling out these programs, such as age-based, starting with the seniors and telling the population that, right now is this age group, is a much easier message to communicate, and then more people can show up at the end of the day as well if there's enough vaccines in a particular location. So I think all of these techniques will be utilized.
Merci. Thank you. Last question. Dernière question.
Thank you. Merci. The last question is from, la dernière question est de Rachel Haynes from CTV News. À vous la parole. Please go ahead.
Hi, thank you. My first question is for Minister Qualtrough, just as a follow-up to what a number of my colleagues have been asking as well about these CERB repayments. And just as a follow-up to Karina, when she was talking about how you had said in December that you wouldn't be, or you would not be forgiving this for people who had taken this on their net income. But have there been people who have repaid that money already based off of the letter that had been sent? And at what point is the CRA going to repay them back for this?
Really important question. Thank you. Yes, absolutely. If Canadians, based on getting the letter, took the initiative and made their repayments because they considered that they were no longer eligible because they had used their gross income, we will absolutely be repaying those payments to Canadians as soon as possible. So again, it's a case-by-case basis. We have to make sure they meet all the other eligibility criteria. But if they do, we will be repaying their repayments, which sounds a bit odd, but that's exactly what effectively will be done as soon as we possibly can. For those Canadians who took the initiative to try and make their tax slips as accurate as possible, we will work with them. We will be reaching out to them, or they can reach out to us and help them settle and balance their accounts.
Thank you. And my next question goes to Dr. Tam, just about this conversation that we've been having about the variants. And you had said in response to one of my colleagues' questions that if public health measures are lifted too quickly, that there could be a resurgence due to the presence of variants. And I'm just wondering if you can tell us a little bit more about what impact you see variants having on transmission going forward. Do you think we're going to get to a point where the majority of cases that we see are from these variants?
Yeah, so right now we are detecting particularly the B117 variant, as we just reported. And 80 countries in the world have this variant, including our neighbors in the United States. And the variants detected in many areas of Ontario, but also other provinces. This particular variant, I think, has definitely a chance to be the one that's replacing other variants. It's demonstrated an increased ability to transmit. So I think more and more evidence shows that this variant transmits more readily. How much more transmissible? I've seen different estimates from different countries, different locations, but the latest estimate is about 35 to 45% more transmissible. So as you can imagine, it's actually quite difficult already to slow down transmission with previously circulating viruses. And you add a virus, then that is more, just makes it much more difficult to get under control. So I think if public health measures are cautiously relaxed, the moment you see increase in cases and the variant is detected, those public health measures have to be rapidly reinstated depending on the findings. So I think one is that it's just going to once the acceleration occurs. So you got to stop these, put on the brakes early if that is the case. The other, of course, is that we do not know the impact of vaccines on transmission at the moment. I do believe we will get some of that information. So we don't know anything about herd immunity at this point, but a variant that's more transmissible, even if the vaccines have impact on herd immunity, it may mean that more proportion of the population have to be vaccinated in order for that to be achieved. So it does have many implications, which is why right now we have to be very cautious. And as local and provincial jurisdictions begin to look at the data within their jurisdiction and cautiously open up, that has to be done very thoughtfully, very slowly, and to see what the impacts are. Does that answer your question?
I think that will be a yes. So thank you everyone for joining us today. Merci à tous de nous avoir rejoints aujourd'hui. Ceci met fin à la conférence de presse de Sputnik. press conference.